bad smell in the nose, or cacosmia as we call it in medical terms. This problem has come into sharp focus after the pandemic of COVID has set in, but by no means is a new issue. Smell is a very basic and important sense needed for a variety of reasons, both good and bad, and when this gets distorted or lost, the effects can be devastating both physically as well as emotionally. Why does this occur? For us to understand this, we need to understand how smell occurs, or the physiology of smell. Smell molecules get sniffed into the nose, into the upper part of the nose, where the smell nerves or the olfactory nerves carry the sensation to the part of the brain where it's interpreted as a particular smell, be it good or bad. So any disturbances in this pathway can cause altered loss of smell or bad smell. And so physically something wrong with the nose or the sinuses or the area behind the nose, which we call as nasopharynx, or the oral cavity or the teeth, can lead to a bad smell. And it also follows that any problems which affects the smell nerve or the part of the brain that is responsible for interpreting the sensation can also cause the same. The commonest cause of bad smell would be anything which can cause retained secretions within the nose or the sinuses. And as all of us know, stagnant water or stagnant secretions can always raise a stink. So some of the commonest causes that cause retained secretions within the nose or sinuses would be allergic rhinitis, especially if it's uncontrolled or severe, even common colds which are severe, acute and chronic sinusitis, wherein there is stagnation of secretions within the sinuses. Amongst all these problems, chronic sinusitis is a particularly important problem because you could have stagnation of secretions for a long time, and patients may not have any other symptoms, which might make it confusing for them to find out where the cause of bad smell is arising from, and especially if there's superadded fungal or bacterial infection of the sinuses. COVID-19 is a viral infection which certainly has brought this into focus, but other viruses like adeno-rhinoviruses, which have traditionally also have caused the same problem, but in these cases the mechanism of the loss of smell or the perverted sense of smell is different, because these viruses directly attack the smell nerves which are located in the root of the nose and may cause damage to the smell nerves and can cause this issue. But most of us who have suffered from COVID have fortunately realized that this problem is usually self-limiting, and usually the recovery is the norm rather than the exception, though the exact duration of recovery can be highly variable, with time frames as long as about 18 months having been reported. Foreign bodies in the nose are a very important cause of abnormal smell or bad smell, and though this predominantly occurs in the pediatric age group, we've also seen adults, and I myself have personally removed foreign bodies from adults as old as 30 years, wherein these foreign bodies have been ignored since probably their childhood. So we do not have any numerical numbers to go by to quantify or to describe this loss of smell, as with as with other vision and hearing. We can put in terms of certain numbers. Here we usually have to rely upon the patient's description for loss of smell, and we as ENT surgeons usually would employ simple techniques like examination of the nose with speculum or the endoscopes, sometimes use X-rays, CT scans and MRIs to arrive at a diagnosis. As far as treatment of these conditions are concerned, for conditions like sinusitis and foreign bodies, usually we might employ surgical techniques to remove the secretions from the sinuses, or to provide a pathway so that the secretions don't get stagnated in the sinuses. And with foreign bodies, we would usually have to remove them. For conditions like allergic rhinitis and common colds, usually it's medical management so as to decrease the secretions that might help patients to get back the sense of smell. For patients with viral infections like COVID, wherein there's direct damage to the olfactory epithelium or to the smell nerve, usually there is a lot of role for oral steroids or intranasal steroids, because it has been proven that these modalities of management not only do cut short the duration of suffering of the patient, but they also enhance the completeness of recovery. Smell retraining therapy is a technique which is nowadays gaining traction, especially in patients whose sense of smell is not returning within a few weeks. Basically, this involves patients to smell various smells, which are usually in the form of organic oils or perfumes, and basically it helps retrain their smell organ or the brain to get back the sense of smell.